afterwards. Great. So I am Courtney Hughes-Franker, and I'm currently the programming chair for WAPA, and I'm really very excited to have our guest with us this evening, a dear friend and colleague, Sheena Nahm McKinlay. So thank you for joining us from the East Coast. So I will go ahead and introduce Sheena, and then I will turn it over to her for her talk this evening. So Sheena is a cultural anthropologist who has worked in health, education, and social services. She is currently VP of Research and Development at Health Leads. Sheena builds on over 15 years of experience at various nonprofit organizations and in academic research institutions. She leverages mixed methods within participatory research frameworks to ensure that population health interventions are being designed, governed, implemented, and assessed by communities. She has worked specifically in cross-sector settings where stakeholders range from large institutions to community-based organizations and resident leadership groups. And I'm going to put a shameless plug maybe in the chat is I had the absolute pleasure of creating an open access resource for intro to cultural anthropology classes with Sheena. And I'm not sure if I put the right link in or not. Oh yeah, well, I put chapter 1 and 2, but you can go back to the beginning, Teaching Cultural Anthropology for 21st Century Learners. And it was funded by Viva, the Virtual Library of Virginia. And we had students involved in every step of the way, from George Mason, and just absolute incredible collaborators of anthropologists across the world. So shameless plug, but something that Sheena and I really enjoyed working on over COVID. We got the grant just as COVID hit, so it was our COVID project together. Dr. McKinlay earned her BA in neuroscience and anthropology from the University of Pennsylvania, an MPH from Drexel University, and holds an MA and PhD in anthropology with a critical theory emphasis from the University of California, Irvine. Her areas of focus include medical anthropology, science and technology studies, and emergent networks of knowledge production. So we are thrilled to have Sheena with us this evening, and the title of her talk is Anthropology and Innovation, Lessons from Community-Based Work. Sheena will speak for about 35 minutes, and then we will open up the floor for questions and discussion. So I will turn the floor over to you, Sheena, and thank you for being with us tonight.
Thank you for having me, Courtney. It's such a pleasure to just be in the company of fellow anthropologists, people who are curious about anthropology, and hopefully this will spark some interesting discussion for us all. Let me get to slideshow. All right. So I had a little bit of fun picking this image just for the title slide, because I think if you do a query for innovation, the images that come up in most stock photos or even search engine sites is some form of a light bulb. And this is a light bulb that's cracked. And so in some ways, I want to explore this idea today in the talk. What does innovation mean? How can we question maybe the idea of the single light bulb moment and complicate it, right? I think there's a lot of stories, hopefully, that bring hope to what innovation can bring using a lot of the methods and approaches that anthropology has taught me, and also a critical lens into, maybe disrupting some of the common singular narratives about what innovation should and could look like. So with that, no anthropology talk would be complete without some good stories to kick off with. And so I'm going to actually take it all the way back 20 plus years ago to two moments in my graduate school career and training where I couldn't put my finger on the exact ideas that were percolating in my mind. And I just had some intuition around some of the decisions I made, both in my master's in public health training and then later in my dissertation work in anthropology. And they later continue to marinate and become some of the ideas that we'll be talking about today. So the first is an example from public health, where I initially started training as a biostatistician and epidemiologist, and had basically completed a lot of the coursework to be able to do some statistical modeling in public health. And I went to a great, program that emphasized practicum-based work and community partnerships. And so very much it was instilled in us, and part of what drew me to the program was that researchers, whether they're grad students or senior researchers, don't go into communities and say, hey, I have this project. Will you partner with me in doing the project that I've pre-developed without talking to you, right? So it's always about first working, volunteering, just being fully immersed in that community partner, asking what they prioritize and what they want to work on, and then from there developing any further projects. And so I had the chance to work with some asylum seeker, refugee oriented organizations, and then also an immigrant health center in downtown Philadelphia. And I started to really get inspired by what they were doing, and learned about a unique project where youth in the community, immigrant youth, were co-designing and developing a multimedia hepatitis B education program. And they were doing this with some nursing students, guiding some of the technical kind of knowledge around hepatitis B transmission, which was more prevalent in this community, but also trying to make it really fun, interesting, engaging for youth, because it was a youth to youth intervention, and also some education students. And so we started working on this project, including pre and post test evaluation assessments. And as the project arc continued, it became very clear that the sample size was not going to be that big, because it was a brand new program. It was a brand new idea, and it was going to be a lot of painstaking work to do all of the end-to-end development of this project. And so essentially, to continue with my major or emphasis in statistics, I wouldn't be able to do some of the core skills or competencies that one needs to do in a thesis. And so I was presented with the option of switching majors and sticking with the same partner, or switching partners in order to access a larger data set. And I chose to stick with the partner because I really was compelled by this idea of what they were developing from its very early stages, right? From an idea to the first draft of a curriculum, to the first draft of the pre-test tool and the first draft of the post-test tool, all of the complicated kind of bumpy elements of data collection really compelled me, right? More than maybe having a large sample data set on the back end, which is exciting, I think, as well, but it's not what was really compelling me. And so I already had this feeling around, what does it look like to co-design with the people who are impacted? And what does it look like to follow the arc of a journey of creating something and narrating its impact in a community at its earliest stages? So that was one kind of snapshot and moment from the past. Flash forward a couple more years to doing field work for my dissertation. And I know this is me, this is baby me, about 20 years ago, standing in front of conference posters, which might seem odd as a fieldwork photo, but part of the work that I was doing was to follow a group of predominantly women child therapists that were being trained in certain models in the US, and then taking it to South Korea and other parts of Asia, and trying to disseminate knowledge and position themselves also as experts in a new form of therapy that was not yet popularized in their geography. And so part of my fieldwork was, doing some of the training in that therapy, observing therapy sessions, interviewing the therapists, and thinking about a lot of the policies that children and families were navigating, and looking at producing knowledge, right? How are they showing themselves as experts, and how are they translating that knowledge and being or not being acknowledged? And so part of my work was to also look at how they navigated conferences. And again, this is where I started to really think about this issue of knowledge production, how knowledge is made, right? Not just taking it for granted, and looking at the power dynamics of who gets acknowledged as a knower or an expert. Very early on, as I was doing kind of pre-dissertation research fieldwork, someone actually told me, I don't think you should do this because it's not really mental health. You should do something kind of more serious and more real as health. And I understood what they were saying. And certainly there are a lot of really important issues to tackle and issues that are affecting maybe populations more broadly. But I, again, was compelled by interrogating, looking at, being curious about new forms, right? Things that were purposely on the margins, that weren't fully acknowledged as the thing I should study, because it's not really a studyable thing, right? And so as I share these stories from many, many years ago, I think what I wanted to point out is the earliest orientations toward design justice and epistemic justice. And this was before I had the words and the readings to talk about all of these things. But really what I've been percolating on and thinking about across the years is exactly kind of those two snapshots, right, played out in a lot of different settings. And so, I'm not the first to talk about these issues. There's certainly a lot of scholars that have done some tremendous work in bringing together some really important discussions. I think about Miranda Fricker and her work around epistemic injustice, specifically that there's two types: testimonial injustice, when you don't believe someone, right, in their story, you just don't believe their words. And then this other piece around hermeneutical injustice, which is you don't believe someone can interpret, right, which is a little bit different, where it's not exactly one-to-one, but I think about sometimes people might be well-intentioned and do a lot of focus groups with community members and believe them, right? But then they are just sort of the source of the data. They're not part of the interpretation process, right? So they're not positioned to do some of the deeper interpretation of their own experiences. And this is where participatory research principles come into play. And certainly something that is really important to me is to always partner with people who are closest to the issues, not just in this kind of distant engagement, but really as troopers, where they're right there with you in the interpretation process. And then, a lot around design justice and making sure that marginalized communities and communities that have often been put in a place where they cannot, or they have not been listened to in terms of designing the very interventions, whether it's social services, whether it's products that are supposed to address the most pressing issues in their neighborhoods and in their cities and communities. And so what does it look like to partner with the most marginalized communities, and also to address the structural and root causes of the things and the challenges that they're facing and the issues that they're dealing with. And then the other thing I want to just kind of center on, right, and keep in the back of our minds as we talk about a lot of examples and bring in some mixed methods application, is this idea that innovation, again, isn't this single light bulb that goes off, right? That something emerges from nothing. But Lily Irani really talks about acts of translation. So in our work in India, this idea that, someone might come up with something, and then as it's translated and seen by another entity, which could be local or, across contexts, and saying like, wow, that's innovative, right? There's this translational moment where something is seen and defined and acknowledged as innovative. And oftentimes that in that translation, there are a lot of power relations of who gets to say and deem something as innovative. And that's wrapped up in money and resources and political economy of, what the power relations are and who gets to then drive how the person who created something gets the right resources to maybe scale or implement their solutions. And then zooming in, just on a very practical level, when I talk about power relations, it is inextricably tied to resources, money, time. And by time, it's not just the time to make a thing, but also the time to be exposed, to other people making things, the time to have a dream and even think that you could be a dreamer, right? And I know that might sound a bit general, but research has shown, for example, and this is a super narrow example, by no means are patents the only way to, again, talk about a single form of innovation, but just even in that kind of more common, maybe dominant narrative of innovation, you look at children from families and follow them, and there is a much greater rate of filing for patents or sort of being positioned in this innovator space later in life if they are from much wealthier families. And this is controlling for cognitive ability and all sorts of other things. And really it boiled down to having the exposure to other people that were innovating and having this sense that, oh, I could be an innovator, right? And having this space to imagine, really, right? And then having the resources that follow that to make those imagined ideas become real. And this has a lot of resonance in very concrete terms. So if we follow the money and follow the dollars, just in a very specific example, I work a lot in social determinants of health and public health. And so if you look at some of the research around, how much money is going into social needs kind of market as a space, it's in the billions, right? And
If
there
you can
is
wait for
a
dinner
ton.
until after 8:30.
There's a ton of money that is invested into the private sector, into the public sector, to support ideas around innovative approaches to addressing the social determinants of health. And, again, even super narrow, some specific investments in social needs technology like resource and referral connections, that's in the multi-millions. That's a conservative estimate. It's probably in the billions. And so you follow that to some emerging research where communities that were, again, supposed to be supported or impacted or solved for, right? Quote unquote, solved for by these new tools are not adopting it, right? And part of it is because that's not necessarily what they would have created. And so what would it look like to give some of that money to the people who are impacted, to processes that partner with people who are impacted in creating solutions that are effective, have higher rates of adoption, and discover some of the incredible ideas that are out there in the world. And one of the quotes I think about is in working with a community leader who's going through a design lab that our organization has developed. He talks about the space, time, and resources to think. And as a community leader, he really understands all of the problems that his community is facing. He understands the tremendous assets in his community and is kept in survival mode, right? To just deliver some services or to find the dollars to keep a nonprofit alive, especially a very small nonprofit, and to have opportunities, compensated time, space, exposure to other people to feel like you can dream or imagine something, right? This is before you have a proposal or a pitch. Just ideas to dream and imagine is tremendous. So just a quick snippet into the ways that this plays out in dollars and how people are invested in and how those definitions play out in who gets resources and who doesn't. And so before we go into some of the examples, it's important to ask who is being acknowledged, who is not being acknowledged oftentimes as experts or innovators, and how can we redirect those resources and be inspired maybe by some of the examples I'll share around how to incorporate methods that we're probably very familiar with in anthropology in addressing some of these issues. And I share these two Paulo Freire quotes because one of the things that's been so important to me is complicating or getting rid of this notion that theory is in academia, and good applied knowledge is in my nonprofit work. And as Courtney shared in the work that we've done together across the years, nothing could be further from the truth, right? The Paulo Freire quotes that I share, which are deep in kind of theory of pedagogy, were spoken to me by a community resident leader talking at a workshop, right? And so this is from a woman in the community. And so I'm getting really good theory on the street, so to speak, and in my meetings and on the ground. And I'm, also thinking about that along the way. Okay, so I'm gonna kick off with a couple case studies in education. We're gonna go through the span from early education and the youngest, earliest years all the way through higher ed. And along the way, there's a lot of parent engagement and grandparent engagement and caregiver engagement that's built in across all of those educational sites. And then we'll move to a couple examples from health, and then hopefully have a good discussion. Okay, so the first example I wanted to share is around asset-based approaches and asset mapping. And so what you'll see here is just an example of a large map that we printed out as we were kicking off. This is from another nonprofit I used to work at. We were kicking off a parent and community engagement program, and it was really important to not make assumptions about what the project should be in terms of community development, and really work with what the parent and community members thought was important to elevate. And so we conducted this at 3 different sites. Most of the sites, well, all of the sites had a community school or integrated service model. So mental health, social services were all made available and were part of the services offered, regardless of the type of site it was. And then one of the sites was co-located early education, primary school, and again, had integrated services built in. The other site was early primary education. And then the third site was more of a social service site that was co-located with an early ed site. And so we kick off, and the first example is some of the data and the results collected from the primary school site. And as you'll notice, there's a lot of stickers all crunched together. This is very much a neighborhood school where I would run into families regularly walking around. Everybody would kind of know each other, walk their kid to school, go back, to their apartment, and then come back for a meeting, right? So it was very much a heavy foot traffic area. And we had different coded symbols based on certain prompts, like where do you go to feel better, right? Where do you go to get healthy food? And that could be a grocery store, but it could be grandma's kitchen, right? And then where are some like positive or negative experiences you've had? And so this was facilitated. And one of the most interesting findings from this particular asset mapping activity was a stack of stickers that appeared. And it was kind of around where do you go to take your children to play, right? So kind of like, if you think about it, it's sort of a playground question, right? Or a park question. Where do you go to take, to be outdoors and to take your children to play? And so there was a stack of stickers, and I showed the map to one of the staff, and they said, well, there's no park there. I know this area, there's no park there. And so we looked it up, and actually it was the lawn of a police station. And, the police department had various kind of like, complicated relationships within the community. But what it had also was this really large green lawn that was flat, that was safe and, cleared of any debris. And parents were really savvy and said, you know what, our area doesn't have much green space, doesn't have a lot of like young children, toddler friendly parks. And we feel like we can take them here. And so there was this uplifting of an asset in their community, and also kind of a creative interpretation, right? So this is different from just saying, pull a map with a directory and, filter are all playgrounds, right? So it was more about what's the knowledge within the community, what's the lived experience, and also having an open mind as to how to see the different spaces within the neighborhood. And eventually, over time, as we went through this process, the parents created a rooftop garden on the school site, and it became a space where parents came and would, water the gardening boxes. The children participated in doing the planting, and that was incorporated into their lessons. We had some really champion, awesome kindergarten teachers that kind of incorporated it into their curriculum as well. And then what was so special was that the students would kind of do field trips, right, to the rooftop, and the parents would be the docents and would kind of talk to them about the different, things that they could learn about, fruits, vegetables, how things grow. And this was also really important, because given the asset mapping around green space, it was sort of a quiet, calm space. One of the moms would just volunteer very regularly to garden. She said, this is a very peaceful moment for me. And again, this is in the context of not having much green space in the neighborhood. And then also one of the things that I was kind of told before the project kicked off was sometimes the parents or family members are reticent to be more involved in school activities because they defer to the teachers, and sometimes because of not having completed X grade level in their home countries, they'll say, well, I don't know how much I can do X, right, in teaching my child. And so in this case, they really were so knowledgeable and partnered with teachers as supporting the real world learning and discovery of their children and of the students. So that was one moment when the asset map led to a lot of important conversations. The second example I'll share is at a very different school site. And this was co-located early education and primary school. And you'll notice the results of this map look very different. There's a few dots in the center and then almost nothing, and then a lot of stickers on the margins, right? And this is because this is what we call maybe a commuter school. So this is in a heavy industrial area. And oftentimes parents lived nowhere near this school. They lived in different cities, different neighborhoods, but this school was very close to their workplaces. And so they would drop off their kids and then go to their jobs, which was in this more industrial area. And so as they did this, a lot of the resources and their answers to questions were kind of outside of the radius. And that was important. And it also meant that they were driving to school on tight timelines. And what that led to was an interesting conversation because sometimes, school administrators would say, oh, we're having a lot of tardies, right? Tardies and students, showing up late. And part of that, the parents were talking about was because, again, in this very, very high traffic area, it was so difficult to make a turn into the parking lot of the school and to get there. And basically they were just stuck in traffic and and no one would leave room for them to make a turn into the parking lot, and that would make a lot of the children late for school. And so one of the things that they pointed out was this just needs to have a keep clear sign, right? And this is just like a snapshot from Google Images, and it makes me so happy to still see this there. And they did a lot of advocacy work with local field deputies of elected officials and got transportation out there and got it changed into a keep clear sign, which addressed one of the root causes, right? It wasn't like sort of, parent motivation. It was like a structural built environment cause of student tardiness. And then the other thing that they elevated was literacy and adult literacy, right? And so this is really interesting because as the parents were talking, they developed two projects actually. One was a rolling library cart of books that the parents could check out and read. And it was interesting, again, in the context of parent engagement. Oftentimes you'll say, oh, we encourage parents to read with their kids or nurture an environment of reading in the home. And so the parents saying like, well, yes, and we want things to read ourselves. And so they had these library cards, and I think one of the teachers said, we actually saw some parents arriving early for pickup so that they could read a little bit just quietly in the space before it was time for pickup. And with that, also the parents talked a lot about how some of the members of their community could, even if the books were available, for example, in both English and in Spanish, had barriers to literacy. Again, this population was predominantly Spanish speaking, but there were also a lot of indigenous folks and different dialects, and so and languages, and so there first needed to be kind of like a literacy from just building literacy in Spanish, and then having access to the books. And so they developed an adult literacy program, which was really, based on their own priorities. And then moving from the visual of asset maps, another great visual method that has led to important insights in the frame of participatory research has been photo voice or photo voice inspired work. And so again, with these school sites, we kicked off a visual methods training workshop, and actually kids, teachers, and parents all participated and went around their school and the community to identify things. It was really interesting to see where there were convergences and divergences in their interpretation. And then we kicked off a more nutrition-focused, food advocacy-focused project. And this photo that you see here with the sodas, waters, chips, also had this story written by one of the women in the community. And I think, in some ways, this is a picture of a storefront, right? But it revealed more meaningful interpretation of what that symbolized to her as she wrote her own story about, what it feels like when businesses target her community with unhealthy food options. And then one of the really interesting things about this was, as the women that we did this participatory research project with developed their work, they then created an advocacy event, and they designed the event themselves. In some ways, as staff, we thought, oh, well, this person probably won't come, this person probably won't come. But they were like, nope, we just follow the directions, right? So if this is the desired invitation list, we're going to send out the invitations. And we did. And so many people came to what was kind of a rented out, loaned out Parks and Rec space, just a small indoor space at a local park. And one of the people that came to that event happened to own an art gallery in downtown Los Angeles, and was really trying to amplify community voice, and was very social impact oriented, and said, hey, what if I opened up an exhibit or a series for this group of women and a couple other community organizers? And so that then led to a gallery exhibition where they added their some documentary film and some other forms of art. And then flash forward several years later, and we had to do this online. I think this was during COVID, but I had the chance to work with college students, and this was a different set of college students than Courtney mentioned earlier. And we wanted to ask what, again, sort of similar idea around asset mapping, what were places they feel supported, where were the places that they felt really inspired, and where were places that they felt discouraged, right? And so we went through this activity where they could place symbols on a map, as well as there were actually a lot in the margin space once we completed the exercise. And that was because we talked a lot about online supports, and whether there were pros and cons to navigating the website. And one of the reasons it was important to do this was because the administrators at the community college recognized that there were some significant equity gaps in outcomes. And so students of color were having more difficulty in completing curriculum or in transfer rates and a couple other indicators. And so they wanted to address that, and they were putting a lot of great resources to address that gap. And so two faculty that I worked with would said, hey, before we brainstorm how to spend that money to address this very important thing, let's ask them, let's ask the students, and let's bring them into the co-design search process. And so as they did that, they talked about, some of the barriers they were facing, that there's this hidden curriculum in navigating college that is more challenging for first generation students, and ways that the built environment of the college could make the diversity, which they felt they had, right, in terms of the student population, more visible, and this ability to connect and collaborate together. Again, thinking about, a lot of working students, part-time or full-time, that are also trying to navigate community college at the same time. And so it was often difficult to find these moments and these spaces to connect with one another. And then also working with local high schools to maybe reframe the narrative around opportunities at community colleges. So those are some examples of participatory research and what co-design and what epistemic justice could look like for educational settings. And then I'd like to share just one example from healthcare. And some of the things that we do are adapted from some common user experience, research and design practices, as well as human-centered design. And so we always ask a simple question and identify the problem, right? And we do this in conjunction with the people that are most impacted. And so the problem that was surfacing in my current work at a national nonprofit focused on health equity was that busy caregivers, right, both formal and informal caregivers, wanted to share their stories, interpret them, so basically be part of this the arc of participatory research and potentially advocacy, but they couldn't participate, right? So we have some ways that people can join meetings and coalitions and series of participatory research, but we know that there's a lot of people not there, right? And so how do we get the involvement, the insights, the voices heard and uplifted from those isolated caregivers when, basically by definition, they don't have the time or capacity or desire to join kind of longer arc teams. And so we conducted a landscape scan, and we looked to see if there were opportunities for innovation, opportunities to do something differently, and found that there was some limited representation. So sometimes whether it's caregivers or other groups, you tend to get sometimes by definition people who are only available, right, to attend those meetings. And so who are the isolated voices? Who are the other people that need to be represented that aren't at those meetings? It would be very time intensive, so it would take a long time, and then you wouldn't get as much of a quick turnaround in terms of real-time ways to adapt and change strategies for policy advocacy, because you'd have to wait and kind of do all of these steps with a longer arc of research. And then it was harder to find kind of like undigested or more raw stories that then could provide insight into things that were just emerging, right? Things that were just floating to the surface. And so how could we do that? We found an interesting platform called SenseMaker that could be customized and essentially could be on mobile or desktop, and people would either write a quick story or voice record. They could also upload a picture, and then they would go through a process, and you'll see these triangles called triads where they would index their own stories and interpret their own stories. So this is something where someone could do this on their own time. They didn't have to join a participatory research team, but inherently they had kind of the power and the capacity to be part of the interpretation process. And this was essentially a distributed ethnography tool. And so we went through a process where we co-designed some of those triangles or triads, those interpretation tools and signifiers. and then designed the specific customized version of the tool for caregivers. And then we tested it out, and we tested it out with English speakers and Spanish speakers. And they identified a bunch of things that needed improving. We asked them, was this useful to you? Was this meaningful to you? Obviously, as we beta test or early stage test tools, if it's not useful or meaningful to the people most impacted, there's no reason to continue. What we found was that there were some slight tweaks that needed to be made, things like improving, some of the buttons, some of the flow. But overall, the user said, yes, this was super meaningful to us. And one of the things that was interesting was that we hypothesized it would take about 15 to 20 minutes, which again, in the scope of caregivers who can't join long, year-long participatory research teams, was pretty short. They could do it at any time that they preferred. And they validated that the average was about 20 minutes. So that was right. One of the things we found was that some people took an hour or an hour and a half, right, which are outliers. But the outliers, when we looked at some of the other data and feedback they provided, they actually said it was by their choice that it took that long. So they took pauses because it was a really emotionally difficult story they were sharing. So they were taking care of themselves and stopping and pausing before they returned, or they were reflecting on their life. So they were just kind of in a more of a appreciative space of reflecting on the journey that they've had. And so that was really interesting. Again, not as like these are the outliers, therefore we need to fix them, taking an hour versus 20 minutes, but really it elevated the fact that they had power and agency in how long they took and the way that they used their time to share their story and be part of the interpretation. So we made some of the adjustments. This is some of the rounds. Round 1 in English, round 2 was a mixture of English and Spanish, and then we also ran concurrently a monolingual Spanish test. And these are some of the results I shared. We created tutorial videos and improved the site before going public with the launch. And this is just like one of my favorite quotes from one of the caregivers who tested it with us, who shared how much it meant to be able to reflect on her life as a caregiver. So with that, I hope it leads to a little bit of discussion, maybe some questions around what it would look like for us or for maybe people we know to redesign investments so that community members can be amplified as experts, as knowers, and as creators. And what would it look like to maybe think of some new tools that could support classic important principles in participatory research? So with that, I'm going to hand it back to you, Courtney.
Great. Thank you so much. Thank you so much for your talk this evening. I loved hearing about your work. So we will go ahead and open it up. So we'll start with Mark.
You're on mute,
You're
Mark.
on mute, Mark.
Yeah, first of all, I just wanted to commend you for all the work you're doing. It's really great and innovative work. And just thinking about the idea of epistemic justice, here was another approach that we've used in a number of prevention, community-based collaborative prevention models, and that is this. So this is sort of this integration of theory and community participatory work, where we actually develop the causal model for whatever the condition or the syndemic conditions that we're addressing with the community. And so that is what we start with in terms of what is the intervention going to look like, or what are the mediators, moderators, what are the other things that we're going to address with this. And then you have that public health background, so you would, there's a partner and an epidemiology partner that I typically work with whose kind of focus is on for those non-stat types, a structural equation modeling and path analysis and things like this. So basically what we're doing is translating this model of causative factors into an intervention, trying to design the intervention components around those, and then testing this model. And and I'm just saying that as in the hope that in this eternal quest for evidence-based programs and practices and et cetera, that then the community generated model in its entirety, including the causal model, then gets some kind of evidence behind it. So, yeah, anyway, we've
Yeah,
tried
thank
it
you.
a number of times.
No, thank you for sharing. I think like that without knowing all of the details, but just even from your summary, I think that brings to mind, how important it is, again, both in like the development of the causal models, and I think to not shy away from things like, oh my goodness, we're going to do um, massive statistical modeling, things that scare away just a lot of people. And I mean, regardless of what your titles are.
Yeah.
And so what does it look like to be part of that conversation together, right? Because we are all capable and important in the knowing and knowledge making process.
Great, thank you. Are there others? I have a question too. And then as others are thinking, but I have a question. Just thinking about maybe your own background and training and such, and your work really includes a wide variety of methods, from photo to the mapping to everything. I'm wondering what it was like kind of knowing your dissertation work and following your ethnography to now kind of be doing these really mixed, innovative methods. And how do you see it kind of transitioning when we think about kind of the traditional ethnographic field work? And then now you're doing this work where you had talked to us about time constraints and the fact that you have to collaborate because you needed people to be teaching these workshops and such like that. So I'm wondering if maybe you could talk a little bit about your own kind of transition from kind of what we think of as kind of this ethnography, and then now this work that you're doing.
Yeah. So I think like the answer lies somehow in that snapshot flashback slide a little bit, because even when I was housed sort of squarely, right, within academia and research, right, doing that initial project, as I mentioned, it was already mixed, very mixed methods. Part of that is because I have mixed methods training, but part of that was because I was trying to make myself useful, honestly, to be relevant in any field site, right? And so some of that was like, okay, if I'm going to be in the room in the therapy session, this is back in the day, they were like, well, we need to record the session, right, for discussion with the parents, or for like training and kind of like credits purposes, right, as they were getting certified. And so my utility was like just standing there and holding video camera. And so there was already this moment where I was like looking at photography and video, right? And then also just being in participant observation mode, doing the qualitative research of the interviews. But then also I started I went into like the National Archives of the library. And so, and I was reading abstracts that the grad students had written as part of understanding the arc of like knowledge production, right, for the therapist. And so, and then I was looking at stats around around like health insurance coverage and mental health prevalence and child mental health in Korea. And so I think I was already doing like, not knowing it, pulling in a lot of these different methods. And so then when I started working for nonprofits, it came kind of naturally to me to mix and match methods as they seemed appropriate and relevant. And then I think you're right. Definitely things move faster, but also sometimes slower in applied settings, I think there's just more of like a concentration or sort of sprint in things. But if you probably spliced out like hour per hour, it's may not be that different. Or maybe it's in both as a practitioner and now as a, as a working parent, I just get really laser focused on things really fast. And I think, sometimes things move very quickly with community members because they, want to advocate for something, or, like in the case of the Keep Clear sign, they were like, no, we're going to get this done now, like way faster than I could have imagined from sort of a purist research lens. And other times they'll say, maybe you thought or funders thought, maybe we even collectively as a community thought that this project timeline was going to be a year, but it's actually going to be longer because we discovered something along the way and we're going to make that go longer. And so it is different in some ways because there's a lot of stakeholders to engage, but I think because of the kind of research I did in public health and anthropology, I was already always in a collaborative mindset. And so there are differences, but it's actually been oddly very similar and continuous in the different settings I've worked in.
Thank you so much. Joanne.
Hi. I was really, really impressed with all of the really creative methods and the audio and the video and all of that. So I wanted to congratulate you for all of that. And unfortunately, I missed the first 10 or 15 minutes trying to find the link and have this thing change Zoom on me, which hopefully will not cause other problems. So I may have missed this. So let me preface with, I may have missed this, but I am also someone who has done multi-methods and participatory action research for a very long career and worked in and out of health and other settings. And one of the things that I think is a challenge for health is that health environments, the doctors, the institutions, they want to control it all, right? And my understanding of participatory action research is not just, okay, we're, bringing in the community and we're helping them tell their stories and all of that, but no, the community runs the show. They're the board, they're helping design the instruments, not just helping, but they're the major input. It's their show. And, and so I'm wondering how that works in your projects, because I was hearing a little less of that, and it may be because I missed it. So let me ask you about that.
That's a great question. I don't think you missed it at all. So that's exactly what discussion is for. I think you're right on in terms of for me, it's like following where's the locus of power, right? And you can't roll out more and more activities, even super well-intentioned, highly engaging activities, if you don't shift the power, right? And the power dynamics. And I think one of the things, I have had the fortune to meet some incredible physicians that are attentive to that dynamic, right? And they'll say things like, well, I want to report to a consumer board, right? And that's like of people who are, their bosses, basically, right? The same way that you have nonprofit board. And so I think that's part of it is in healthcare environments, making sure where, that like even at patient advisory councils, are they serving as ad hoc focus groups, which has a utility, but it's not a shift in power, right? But if you think about that in comparison to something like a consumer board where there's some decision-making rights, some ability to say, the same way any board that we think of would be like, no, we're not moving forward with that, or we're gonna veto certain resource allocations, right? There's like a power shift that needs to be happening. And so I think a lot of times, I don't know if this is like as exciting to people, but one of the things that I get really passionate about is governance structures, right? And accountability structures. And you cannot roll out even the coolest of methods or the coolest of engagement activities if you don't reconceptualize and restructure the governance. And so that we've done, we either partner with or directly try to create accountability into whoever the end user or consumer is as some kind of decision-making governance group.
Great, thank you.
And I want to read a comment in the chat as people are thinking of questions or other comments from Kathleen Crane, who writes, great work. There is such a premium put on formal knowing that leaves community in an unrespected position in much formal research. It is so important for those of us who do research to insist on placing the community at the center and in the lead. So thank you. Lori, go right ahead.
Thank you very much. I agree. This was a great talk. So thank you very, very much. I really like your work. I wanted to say it sounded to me, I'm sorry, I came in a little late. It sounded to me like all your work has been in the US. Is that correct? Okay. Yeah, go ahead.
So the nonprofit work has been in the US post graduate school, I guess. But my original field work was transnational. So it was the US and then South Korea.
Okay, thank you. Because almost all of my work has been in the global South, and that is really different. And governance structures, you're absolutely right. Governance structures are where it's at. The only time I've really been able to do the kind of community work you're talking about is in remote villages in Alaska. And then the state came in and said, it will not be this way, because we're defunding this. So even working in Peru, where I also use Paulo Freire. And so I laid out the theory in the beginning of the project and said to all our offices, this is what we're using, and I'm using Paulo Freire. No one had heard of Paulo Freire. Or the 60 people who are seasoned development professionals, no one had heard of Paulo Freire. This was an environment, though, not health. Even in health, I'm sure no one's heard of Paulo Freire.
No, true.
And so, yeah, Marcus agreed. So it's really different, and governance is really, really important. And I also want to validate you're using life histories, essentially, people telling their own stories, which is what we're doing in a project that I'm working on now, because I said we had to do it. But the people who are local people are taking the life histories. They're not really, they're writing them down. It's really the women who are talking about. And one of the ways of getting the most vulnerable and least accessible people is design a project for the most vulnerable and least accessible people, which is what we're doing with women waste pickers. They are the poorest of the poor. They are the stigmatized. They're the people that no one wants to even talk to, not allowed to touch. And another anthropologist actually came in with their part of their curriculum, and they have all these psychometric scales, right, on leadership and agency and confidence, and they're able to show that these women were able to increase their scores on this. And so, but the life histories are showing, oh, no. Some of the women really were affected and did change their lives. But other women, I mean, they may have scored higher, but they still have anger management problems because they're poor and they're oppressed. They still have food insecurity. They have their livelihoods haven't increased, which is what's supposed to happen with this project. So on and on. So I think it's really important to let people tell their own stories, to give them space to do it, and to have people from the community themselves. This happened to have been an NGO that I taught to take life histories, but that they were very well entrenched in this community and knew these people really well. So I think it's really important. I think you're absolutely right. And even in the global South, you're absolutely right at work. Thanks.
Thank you so much, Lori. Sheena, did you want to respond at all before Emily?
All the plus ones to everything Lori shared.
Emily, please. Emily, are you there? Your hand's up. I just want to make sure.
Yeah, it would be nice if I turned on my microphone.
Oh, okay.
That helps. Well, first of all, I really enjoyed your presentation, and it was just a joy to hear how creative you have been in using participatory approaches, and your steadfast belief in the people, which I think is the most important thing to have. And on governance, I totally agree. I work in what is now being called the Global South a lot, and then also in some very difficult places in the Global North. But it turns out that in national policy planning, we all call it national policy planning, but when I do it, it's not. It's subnational policy planning, which starts at communities, goes up to districts and to regions or provinces within countries. and then up to the national level. Of course, I'm playing all the levels at once, but I have the activities going on at the different levels. And basically, the voice of the people, Vox Populi, comes in, and they are listened to very much because it's a thunder. It's not a little voice. They're all over the place, and we don't do every province in a country or region in a country, but we do strategically selected sections of the country. And when you keep, and it's what I always find, and what is, of course, always a big surprise to the decision makers, is that what people are saying at the local level is so similar, at the district level so similar, at the regional level so similar. Depending upon the country, you have different designations up and down in decentralization. And suddenly they become aware, and they also have the opportunity of participating in multi-sectoral groups going down to the local level, because I always drag the people from the top down to the bottom so they can actually hear it with their own ears and have their own experiences, and then work on it up the thing. Now, what I have not done is write a study on this, but I'm thinking about it. And I feel that there's a lot that can be done on governance issues, and amazing changes can occur as a result of it. It requires a bit of skill in negotiation and consensus building, I will say, but it is doable. So I encourage you to take boldly the work that you've been doing and begin to work at the local level, at the next up level, whatever it is, at the regional level and at the national level, to see what you can do. You'd have to define your areas, of course, but I think that you would have an immense amount of fun out of doing it, and you would learn a lot.
Thank you so much. Sheena, did you want to respond to any of those thoughts that Emily raised?
I couldn't agree more. I think something you've said, I mean, there was so much to what you shared, Emily. I certainly would love to read anything you hit up on, but one thing that jumped out to me was just this idea of, and oftentimes as we've done sort of like consulting on how to set up governance structures, there's always this like either or conversation around some, protected spaces where you can really center a community voice, and that their voices don't get kind of overshadowed by larger institutions or other things. And so then having that really intentional space, right, for a lived experience and community voice, and right, the importance of then having that integrated into the governance structure in the same way that we think about maybe like policy work groups that are specialized, right? But then you have to somehow scaffold that or bring that in so that there's cross-sector knowledge,
Exactly.
right? And so
Exactly.
totally. And the idea of like, even if there's a consumer group, that there's also a danger to when you have like, this is the institutional governance structure and here's the community governance structure, and then they're not blended somehow. And that doesn't mean that you don't create important intentional separate spaces, but what does that look like cross-sector, cross-stakeholder, cross everybody, right, in order to build power together?
There are some very simple but effective methods for breaking down single sector approaches and creating multisectorality. But you have to do it consistently at every level, because every level has their created interests or their vested interests of holding on to this or holding on to that. Also, when you work together with people, they're your friends. So you want to sit next to your friends. So you have to get them to sit in different places. That's another thing. So, yeah, no, but you're absolutely right. Those are very important points to take into account. I'm enjoying talking with you because I think that I rarely get an opportunity to find someone who really, really has been doing it and understands what is involved. And sometimes I find that some of the things that I've been creating over the years, really, there isn't a language for it. In other words, we don't have terms, and it's silly to create nonsensical terms, but we have to communicate these techniques, and I'm doing it, but I'm not sure that I'm doing it the best way. Let's put it that way.
Thank you so much. Neil.
Hi. A simple question. Can you tell us how people you worked with in the field have responded to both the methodology and the technology you bring?
Yeah, so in terms of response, I think I wouldn't be here able to even share the stories if there wasn't a good response because I wouldn't have continued. I wouldn't have been like, well, I think photography if nobody else was into it. And I think part of it was just that, I think regardless of whether it's in writing or in photography or in any of these tools that we're using, um, ultimately the heart of why there's good response or engagement is because we're saying that the power is in their hands, right? To tell their own story. And then the other piece that really, I'm more of a text-based, I'm more of a writer. I'm not necessarily a photographer in any way, shape, or form, or naturally sort of like of gravitate towards the visual arts. But the reason why I started to incorporate so many of those things in methodology was because it really helped translate across different languages and different cultures and groups. And it also in just a very engaging way made it more accessible based on different literacy levels, right? And so it became something that was super tactile, super accessible for a lot of the community members. And I think that also opened things up versus like, please fill out this survey.
When you bring your information back to your funders or policymakers or decision makers, is it always in English or do you use voices from communities who don't speak English?
Yes. So, obviously we translate if certain things need to be disseminated and they wants to read it in English. We try to keep actually as certain parts in Spanish. So, and I think there's like, or whatever language it is. I'm just using that as an example because it was a big primary part of earlier work for me. And so there's some decisions that are very intentional, like sometimes like putting the original language before the translated language, which might be kind of obvious, but instead of putting English above it, and which is more inconvenient, it is more of a convenience to the reader who we anticipate and perfect, but saying like, when you're going to have to scroll, right? And putting the original source language first. I think there are times, for example, where we would, um, we've had some advocacy where the, for example, like if the parents and community members were meeting with field deputies of local councilman's office, they're speaking in whatever language they prefer. And we bring, live interpreters, we do translate the products so that it can be, understood and ingested for some of the policymakers. But wherever possible, we do try to preserve the, I don't know what you would call it, but this design principle around not furthering the narrative that there is like one language that's the better, like kind of the better language that knowledge appears in, right? We really try to challenge that assumption or presumption, and still have to do some translation if we expect someone to read it and understand what we're communicating. I
Thank
don't know
you.
if that answered your question, but
Thank you so much. While others are thinking, I have another question about you had worked in such a wide range of ages from elementary school through higher ed. And I'm wondering how and it seemed there were similar, like with the maps and thinking of from the elementary school to the college camp or the park to the college campus. I'm wondering if you could talk about the difference in working with the different ages of children and maybe who else maybe you have kind of talked to about um, how do you do this activity with elementary versus higher ed? I'm just really curious.
Yeah, that's like, you know me well, Courtney. That's one of my favorite parts of this journey is having worked with very young kids all the way to, like, yeah, as you mentioned, to higher ed, and I would say actually with parents and grandparents, right? So we're going into like many more generations. And it's always incredible to see the things that they come up with that nobody could have anticipated or imagined because they're just not they're not that in that experience, right? And so I think some of the differences, I mean, usually we partner with someone who like really very much is an expert in that kind of age group, right? Or things like that. And can kind of do a little bit of the translation. For example, if it's like an early education teacher or a kindergarten teacher, they might be able to say, okay, well, this is what a voice could look like in a first grade class, right? And then and working with faculty who were community like really understood their students at the community college. So we always try to partner there just because there's good lessons and insights I've picked up along the way, but there's no way to have that breadth of exposure and say like I'm an expert in working with every single age group. And so I think just the humility to always partner with people who know it well, and on top of partnering obviously with community and most impacted group. And then yeah, I think, oh, I'll share like a fun example in terms of co-design with kids. So there's this great example of I forget what exactly was being designed, but they were co-designing an app or like an internet portal for the kids to enter into. And it was because, and you can imagine this, only because they co-design with kids, the way that you activate certain parts of the portal or enter into it is because there's a big button that says do not press or do not touch, right? And if you have like a middle-aged software designer, like there's no design principle where you're like, oh, the way that you click on the activating button is going to say do not touch, right? But if you ask I'm thinking about my son or Courtney or something, right? Like if you ask a kid, they'll be like, that is exactly the way you get us to push the button and enter, right? And so that's just, it's a fun example as we kind of wrap up, but it's there are much deeper and kind of powerful, serious examples. But I think like the spirit of it is the same, whether it's a button or some of the examples I shared in my talk that, had a lot of deep impact in the community, which is like, you never know until you ask. And the people that often don't get asked, but should be asked, have some incredible solutions that they could uplift that maybe the quote unquote like typical experts, right, would never have come up with. Again, I think about, you could have the best software engineer there or designer and they wouldn't know that 8-year-olds want a button that says do not push.
Mark, go right.
You're on mute.
Yeah, no, just a quickie little question just related to patents, because you had brought that up earlier. Patents are, one of the other things, and I don't know if you've encountered this. I mean, in even thinking about where people could take their own, sort of indigenous innovation and put it into practice. I mean, the patent process, and just in my own experience with this, I mean, it's a couple of things. One, it's expensive. Especially if you have to go through these, multiple iterations and things like that. So if you were trying to facilitate that channel for people to translate innovations into some, an app or a device or whatever it might be, how would you, what would you do in terms of setting up some supportive structure for that?
Yeah, I think we need another hour for that, just that
Yeah,
one
I'm
alone.
sure.
And
I'm sure.
no, it's such a good question. And I think like one thing I'll just share is that there's a tension between, this conversation we're having where Indigenous folks need their like to have the tremendous innovations, right, that they have and continue to produce acknowledged, resourced, right? And some of that does come through formalized channels like patents, right? Not always, but sometimes, right?
Sure.
And then this other thing around that then kind of falls in line with capitalism as the means to legitimize knowledge, and if you're trying to not only say that there's a different form, like broaden our paradigms around innovation, it's like, what does that look like outside of chasing capitalism? And also the tension of like, we still live in it, and people need to, that have like entire communities that have been left out of investment processes and are not given resources, are then, if you follow that cascade, right, of consequences, it's like, then, then this is where you see such sort of disenfranchisement and like lack of economic investment, right, in marginalized communities. So it's a little bit, I'm kind of dancing in circles a little bit, because it's almost like the thing that you have to do, but then you don't want to do it, and should you even have to do it, and that gets really complicated.
Just have a bourbon and get pragmatic, just kidding.
Great, thank you. And Kathleen, would you like to just remind us all of the NAPA standards and where they can be found? Maybe say just a few words for everyone.
Oh, sure. Thanks, Courtney. That wasn't intended to be an advertisement.
Oh, no, not at all. I think it would be wonderful for all of us to hear.
National Association for the Practice of Anthropology has worked over the last year to create standards for professional practicing and applied anthropologists. And we took these on the road to share them and get feedback and hisses and boos and applause from a variety of audiences, including WAPA, which I have to say, and I said this not in this forum, was a remarkably helpful, critical in the best possible way audience for the standards. And we are going into version 2, which will then go up on the NAPA website, www.practicinganthropology.org, and will become as final as a living document can become. And it is really intended not to teach skills, but to talk about how we do our work and how good anthropologists should do good work. And so, Sheena, your placement of people at the center, insisting that people are at the center, is something that we put into the standards early on. Being good ethical anthropologists, placing the work before our personal interests. And it does sound a little like Mother Teresa, but we also think with powerful tools comes powerful responsibility. And so the current version is on the website. It's accessible. The movie is on WAPA's YouTube channel. And soon to come to a big screen near you. So thank you, Courtney.
It's hard to be Mother Teresa,
Thank you so much. I just want to make, we are coming to the end of our time. So I just wanted to ask if there's a last call for questions, thoughts, comments for Sheena this evening before we close. No, well, I think if we could all thank Sheena again for your presentation and for sharing your work. We're just so happy to be able to have you with us this evening. Thank you so much. And for WAPA, our next event, we are planning another We're going to do two kind of networking social events. So we want to do a happy hour. We had one in Tyson's Corner, so we'd like to do one closer to DC or kind of Silver Spring, that area. And then we also had requests for doing kind of just a networking online. So we'll try to do a virtual social event too for May. And then in June, we will be hosting a panel on public archaeology. And then we will wrap for our summer vacation and then come back in the fall with our Praxis Award winners. So I want to thank you again, Sheena, for taking the time out of your day in San Diego to be with us. And hopefully we can invite you to come to future WAPA talks and events to virtually. So, and whenever you're in the DC area. I had the pleasure of getting to see Sheena in person a couple weeks ago when she was in DC for work. So it was really nice to catch up. But thank you again this evening. And thank you to everyone for being with us, and hopefully see you at our future events, and emails will be coming out soon. So thank you so much. Thank you, Sheena.
Bye, everybody.
Have a great evening.
Thank you, Courtney, for organizing such great panels.
Thank you, Courtney.
Oh, no, it's my pleasure. Thank you so much. Thank you. Have a great evening, everyone. Have a great rest of your day, Sheena.
All right.